Hi, my name is Jessica Xiong, and I will be discussing about case 17.2 in the textbook, The Clinical Assessment Workbook by Elizabeth Pomeroy. So I will be analyzing case 17.2. I am a worker on call at the Good Heart Mental Health Center. I received a call from a local law enforcement about evaluating an elderly African American woman. Her name is Olivia Joyner. Now, during the initial contact with Ms. Joyner, the diagnosis that I am considering is mild neurocognitive disorder. The reason why I chose this diagnosis is because when I spoke with Ms. Joyner, she remembers her name and she speaks clearly, but there's evidence that she's declining in memory and learning. She loses track of our conversation and she brings up different topics with random questions and comments. I do not believe it is major neurocognitive disorder because she is able to engage and have a conversation, but I do believe it is progressing to major neurocognitive disorder. Now, after my initial contact with Ms. Joyner, the diagnosis I would give her is unspecified delirium, because in my conversation with her, she reduces her ability to direct focus and she shifts her attention a lot. She's also very unaware of her environment and where she's at. She has a lot of memory deficit as well. Now, if I were in contact with someone else other than her family members, I would contact Greyhound bus station to see if they have any ideas of what may have led her from Indiana to Georgia. I would also ask if they had any information on her schedule and travel information. Now, after my phone conversation with Olivia's daughter-in-law, I would not change my diagnosis for Olivia. I would wonder what could have occurred that had caused her to have this disturbance in her cognitive and disorientation, since her daughter-in-law did mention to me that Olivia is pretty sharp and she can handle herself pretty well. And so I would wonder what may have caused her to be redirected to Georgia from Indiana, and also just her disorientation and just her disturbance in her cognitive. After speaking with the ER nurse, my final diagnosis for Olivia Joyner is mild neurocognitive disorder due to traumatic brain injury. Now, I made changes to my diagnosis up till now because when the ER nurse stated that she has a brain bleed, and with all her symptoms such as post-traumatic amnesia, disorientation, and confusion combined, it is a diagnosis of mild neurocognitive disorder due to her brain bleed or her injury. And so that's my final diagnosis, and it's definitely due to a brain injury that had occurred. Now, the psychosocial and cultural factors that I found in this case 17.2 was V62.89, Z60.0, which is phase of life problem, and V15.89, Z91.89, which is also other personal risk factors. I found all this information also in the American Psychiatric Association DSM-5 book. And this is my reference page.